For most of 2024, the MRI machine at the Queen Elizabeth Hospital has been operating at 50% staffing. Wait times for all but the most urgent scans are the highest on record, far beyond targets. For a routine MRI, the expected wait time is now 2 years.
Obviously, waiting 2 years is totally unacceptable. I mean, nobody should have to wait that long. If you have an illness that's serious, by the time that comes around, it's not going to be a great outcome.
Health P.E.I. says staffing will be back to normal in the new year. But on the growing backlog of Islanders waiting for scans, Health P.E.I. would only repeat the same message it provided in September, that it is working on out-of-province pathways to help alleviate the current wait times. No one from Health P.E.I. was available for an interview, neither was the health minister, who said this during the fall sitting of the legislature.
We can send people away or do 1 million MRIs, but we need people to read them. We need to improve surgery times. If we send people for scans and they can't move through our system, what's the point? So we need to work on the entire pathway.
P.E.I. won't pay for a private MRI, for example, at the clinic in Moncton. But for Edgar Arsenault, the $1,200 he paid out of pocket helped get him the treatment he needed to walk again.
3 or 4 days, I got an email with diagnostic of my knee, saying what was wrong with it and what probably would need to be happen. I think it's unfair, yes, but I think either government should pay for it or government even install a private clinic in P.E.I.
The Green Party says this situation has opened up a path to expedited treatment, but only for those who can afford it.
And that's not what we want. What we want here is equal access. That's what the Canada Health Act requires, is accessible, equal access to health care in this country.
McFarland says Health P.E.I. should have at least one more MRI machine. National figures show the per capita number of machines in P.E.I. is half what it is elsewhere. Those figures also show that even before the most recent slowdown, Islanders received fewer MRI scans than in any other province.
Many people can't go to work because they're unwell to the point where they need a diagnosis. But without that diagnosis, radiology is a bit of a keyhole. You have to get through that to have a diagnosis. It's very hard to get surgery. Nobody's going to give you chemotherapy unless you have a diagnosis.
There is a lack of MRI technologists across the country, which clearly has hit P.E.I. particularly hard. But even if staffing here gets back on track, P.E.I.'s MRI capacity has not kept pace with population growth, so even a return to the status quo is unlikely to make this issue go away. Kerry Campbell, CBC News, Charlottetown.